All right, it is 32 minutes gone past 11 a.m. right here on your number one family radio, Inspiration 92.3 FM. It's still the Saturday morning show. My name is Beatrice, and this is now the segment that we call Surviving Sickle Cell. This is a collaborative show with between the Sickle Cell Foundation Nigeria and Inspiration FM 92.3. Today we have the 178th episode, and the topic for today is organs at risk in persons with sickle cell disorder part 2. That is organs at risk in persons with sickle cell disorder part 2. Our guest today is Mrs. Ayo Otaibe, who is a retired director of nursing, Nigeria Port Authority, Lagos, and now head of department genetic counseling, Sickle Cell Foundation Nigeria. She's also a lead genetic counseling trainer for all counselors all over Africa. Yes, of course, you can call in to ask any questions you have about sickle cell disorder. You can call 0700 923 923 923. We have a guest on the line. Good morning, Mrs. Ayo.
Good morning. How are you?
Very well, thank you, Ma. Good to hear you.
I didn't get your name very well.
Beatrice.
I know. Kolade, Mama. What's the other name?
Kafayet. Yes,
Kafayat.
yes, ma'am. My name is Beatrice.
Okay.
Good to have you on the show today.
Pleased to hear from you.
Likewise, ma'am.
Okay. So we go straight.
Yes, we
to
do.
Organs at risk in persons with sickle cell disorder. Last week I mentioned that organs are at risk in all persons, whatever their hemoglobin genotype, but for reasons that are not always clear. It is true that persons with sickle cell disorder have more organs at risk than persons without sickle cell disorder. But I know some people who are professionals over 60 years old who have sickle cell anemia. They are living healthily, they are living productive lives over 60 years or even 70 years. I've also known some people who don't have sickle cell disorder yet died at younger ages, either with cancer or with kidney disease. But on the whole, people with sickle cell disorder have more organs at risk. I will start with you don't recap the red blood cells. We all know that people with sickle cell disorder, especially those with sickle cell anemia, which is hemoglobin excess, they have persistent anemia. The anemia varies from moderate to severe. Anemia occurs because the red blood cells containing hemoglobin excess have very short lifespan. The consequent anemia reduces the ability to convey the extra oxygen required to effectively participate in competitive sporting activities. But fortunately, it does not affect the oxygen required in the brain. Hence, persons with sickle cell disorder are able to succeed academically and distinguish themselves in various professionals. The oxygen required does not affect the brain. That's why you see them doing very well, lawyers, accountants, and many professions. So, but it affects their red blood cells, so they have anemia, chronic anemia, that they can't do strenuous exercises. Then it affects the lungs. The lungs can be seriously affected in persons with sickle cell disorder by a condition known as pulmonary hypertension. This happens when the pressure in the blood vessels, that is the arteries in the lungs, become higher than normal, and that leads to personal and clinical difficulties. When they have hypertension in the arteries in the lung, they cannot perform. It may even lead to death if it's not properly handled. Then I mentioned priapism. I say priapism is a prolonged, unwanted, and it's usually painful erection of the penis. It is a prolonged, unwanted, and usually painful erection of the penis. It may be short-lasting. When it's short-lasting, that is minor priapism, it lasts less than 4 hours. Or it may even last several hours or days. It can affect a few of the people who have other various disorders like leukemia and lymphoma. But the commonest occurrence in people with sickle cell disorder, particularly sickle cell anemia, they have more of priapism, unwanted painful erection of the penis. And if it's not properly handled, it can lead to impotence. So it can affect children who are not more than 3 years. Then the brain, strokes affect the brain and may not only prevent physical movement of limbs, but also affect other brain functions. Stroke occurs when there are significant interruptions in the supply of blood to the relevant part of the brain, usually due to blood clots. Or blood loss. If there's hemorrhage or if there's a blockage of any artery taking blood to the brain, stroke can occur.
Okay.
We all know that in the world, stroke occurs in adults and hardly in children or even young adults. But unfortunately, for yet or no reason, strokes in persons with sickle cell disorder, mostly sickle cell anemia, HBSS, occur mostly in children aged 3 to 3 years. But thank God, there is introduction of transcranial Doppler. We call it TCD ultrasound. It is available at the National Sickle Cell Center, Lagos, opposite Lutz. It will detect sickle cell disorder children who are at high risk of developing strokes in order to provide them with stroke prevention therapy, such as hydroxyurea and monthly blood transfusion, so stroke can be prevented.
Okay.
Since there is an equipment at the center that can detect the children who are at high risk. We know a lot of children have been prevented from having stroke since we started in 2011. Then the eyes can also be affected. Apart from a longer lifespan, people with hemoglobin FC disorder generally enjoy a better quality of life with far less frequent or severe crises of pain and or anemia. But however, eye complications seem to affect persons with hemoglobin SC more than those with hemoglobin SS disorder. So last week I explained how it affects the eyes. So I now said that all persons with sickle cell disorder, particularly with hemoglobin SC, should have regular eye checkup at least once every year.
Okay.
Otherwise, when eye problem occurs, it can lead to blindness. So it's good for them to check their eyes at least once a year, whether you are SSSC, but because it's common in SC. And all children whose parents are having hemoglobin AS, AC, when they have their children, they should make sure they do their hemoglobin genotype in reputable labs that can diagnose hemoglobin genotype correctly. So that if they are FC, they will quickly be handled and they'll be doing their eye check at least once a year to prevent blindness.
All right.
Then we have acute splenic sequestration. This term is used to describe the collection of blood cells in a person's spleen. This leads to more severe or fatal anemia, which often requires blood transfusion. It is most common in young children with sickle cell anemia, hemoglobin SS, usually aged between 4 months and 5 years. It requires urgent blood transfusion, and future episodes can be prevented by daily use of hydroxyurea. It's a special drug. When they are on it, they are monitored. They can't just go and be on it on their own. Otherwise, the spleen should be surgically removed. After removing the spleen, which is called splenectomy, when it's removed, that child will be placed on lifelong penicillin by mouth. Penicillin V should be given to prevent future bacterial infection. In Jamaica, a research done showed that because when they come for counseling, we teach mothers of these young children how to feel for the spleen, so that if there is going to be blood collection rapidly in the spleen, they will quickly take the child to the hospital.
Yes.
By teaching them this, a research done in Jamaica when I was there showed that 95% of children's lives were saved because of teaching parents how to feed for this. Immediately they notice it, they rush the child to the hospital. So it is very important. Then how it affects I'm now going to how it affects the liver too. The liver, there can be liver sequestration. This is much less common than splenic sequestration and is commoner in adults with sickle cell anemia. The liver is enlarged and painful. It should be treated with antibiotics, especially as surgical removal of the liver is inconceivable. It's inconceivably dangerous to remove the liver. So it's treated with antibiotics. Preventive treatment with hydroxyurea should also be introduced. Then the gallbladder. The gallbladder is a small organ located behind the liver. It has several functions, and the formation of gallstones within it. It is commoner in persons with sickle cell disorder. This may lead to infection and to severe pain. Treatment with appropriate antibiotics and even surgical removal. They can remove the gallbladder. And this is conceivable. I've seen a man, 38 years old, the gallstones filled the jam bottle when the operation was done, just to save his life. Then how does it affect the bones? Painful bone crises are commoner in persons with sickle cell disorder. The definite cause is not well known, but reduction of its frequency can be achieved by daily injection of appropriate dose of hydroxyurea. Taking hydroxyurea by mouth can reduce painful crises. Therefore, the bones also can be prevented from being affected. Bacterial infection in bones is known as osteomyelitis. It's also common in persons with sickle cell disorder. It should be identified early for treatment with appropriate antibiotics to be effective. Otherwise, the osteomyelitis may become chronic. Chronic means it's a lifelong. I've seen one who has carried it for 11 years before he came to us. The bone was infected, bone of the leg was infected, had been carrying it about, discharging pus for 11 years. It's difficult to resolve without surgical intervention, which has its own disadvantages. But thank God, when the boy came to us, appropriate treatment was applied, and the bone was healed.
Amazing.
Some bones, especially around the hips and shoulders, also become chronically painful and less functional owing to inadequate blood supply. This is known as avascular necrosis. Avascular necrosis. So I will talk more on avascular necrosis because you see them limping and you don't know why are they limping.
Yes.
So I will just expatiate a bit on it.
Okay.
Avascular necrosis of the head of the femur, that is the thigh bone, the head of the thigh bone, and of the head of the humerus, the upper arm bone, can occur in adolescents or adults. The head of the femur fits into the hip joint, while the head of the humerus fits into the shoulder joint. Avascular necrosis means the death of a bone caused by reduced or absent blood supply. It can occur when sickle red blood cells block the blood vessels, the arteries that carry blood to the head of the femur or humerus. So this deprives the bone of oxygen and nutrition, so it cannot maintain the structure and strength, and it collapses. This is called necrosis. It is dead. Necrosis means the death of the bone. The bone becomes dead, and it can collapse. So AVN is much more common in the hip joint. It's more common in the hip joint than in the shoulder joint, probably because the head of the femur bear the weight of the body. The femur the hip, it bears the weight of the trunk of the body. So when the head of the femur is weakened because of inadequate blood supply, the weight of the body then easily compresses and flattens it. This can lead to shortening of the leg on that side. When they are shortening of the leg, you see them limping. They are now limping. That is why they are limping. The bone of the head of the femur is dead. The weight of the body is on it. It's not flattened because it has no power again. So one leg becomes shorter than the other leg, and they become limping. And when it affects both hips, they cannot even walk. Either they are walking with crutches or they are in a wheelchair. So the damaged bone is also prone to infection, which is osteomyelitis of the head of the femur. So the surrounding hip bones can also become infected. The humerus can also be affected in the same way, but this is less common. When it's like that, they go for hip replacement surgery. They now go and put artificial head of the femur so that they can walk straight. So it is expensive. It's those who can afford it that normally do it. That is how. So that is how it affects these organs. So fairly, we also know that they have leg ulcers. They have leg ulcers.
Yes.
The common signs of non-traumatic leg ulceration in person with sickle cell disorder, particularly BSS, are just above their right or left ankle. This ulcer comes on its own most of the time for unknown reason. It just comes on its own. It may start as a small boil, bringing pulse and blood. If care is not taken, it can spread quickly, and it takes time to heal. And when it heals, it may break down again. Even when they do skin grafting, it can break down. It's very stubborn. So we have, for no reason, these ulcers are much less common in sickle cell disorder patients in West Africa than in the West Indies. When I was in Jamaica, there are more. You see a lot of them with leg ulcers there. We don't know the reason behind it. They are saying maybe because they don't have iodine enough. A lot of unknown reasons. So, we have some with leg ulcer, but not as common as in West Indies.
Okay.
Fairly recently, we discovered that dressing the ulcers with artemisol. Artemisol is a solution developed in Ghana. It heals the ulcer faster than usual. But leg ulcer is a very bad thing. Those who have been counseled, when they see it, they quickly run to us. Their own heals faster. But those who went and those who go about and go to the wrong hands, put concussions, native medicine, by the time they come to us, the ulcer goes from the ankle to almost the knee, and it can take years to heal. And when it heals, it can break down again.
All right.
So, conclusion, it is advisable for all persons, whether you are an adult, a child with sickle cell disorder, to register in a dedicated sickle cell clinic under a hematologist. A hematologist is a doctor specialized in looking after people with sickle cell disorder for regular checkups. There are pediatrician hematologists for children. There are also adult hematologists for adult people with sickle cell disorder. Regular follow-up visits and carrying out of the relevant tests on these organs at risk by the hematologist can help to detect any organ that is about to be damaged. An appropriate intervention is applied without delay. When appropriate intervention is applied, a lot of these organs, the damage can be prevented. So it is good for them. When they feel unwell, they should go to doctor. They should also register and be going for regular checkups because prevention is better than cure. And there's this saying that a stitch in time saves 9. Thank you for listening.
Absolutely. Prevention is better than cure. Thank you so much, Mrs. Ayo Otaigwe. This has been.
I just want to say, if they want to know more about us,
yes, please.
We are. They can come to Sickle Cell Foundation Nigeria, National Sickle Cell Center, opposite Lute, Idiaraba. We are there. If they want to know more, they should come for counseling. We have seen that those who are counseled, Bible says, my people perish for lack of knowledge. Knowledge empowers you to do the right thing at the right time.
Absolutely.
Those who are counseled, they are living their life. They join Sickle Cell Club. They are less stigmatized. And they are happier, they are living healthy life. And they know they will register in dedicated sickle cell clinic. They will go to quack doctors. It's not every doctor that knows about sickle cell.
Right.
It's not every nurse. There are specialists. So they can get us also, Sickle Cell Foundation, Facebook, Sickle Cell Foundation Nigeria, Sickle Cell Nigeria Twitter, then Sickle Cell Foundation NG, that's Instagram.
All right.
And they can get us on +234 803 584 6666 +234 8100 2003. If they want my number, 0913 734 7939. Or 08033439199.
All right. Thank you so much, Mrs. Ayo Taigwe. Thank you so much for your time on the show today. Do have a lovely weekend ahead, and we'll talk again next week, Saturday. Thank you.
Thank you. God bless you.
All right, this has been Surviving Sickle Cell right here on Inspiration 92.3 FM, which airs every Saturday, 11:30 a.m. all the way to noon. It is a collaborative show between the Sickle Cell Foundation Nigeria and Inspiration 92.3 FM. Do join the show again next week, Saturday, same time. All right, this is where we have to draw the curtains on the Saturday morning show. It has been a fun one, and we have to go. The Saturday afternoon cruise kicks off at 12 o'clock. I hear Kafayat stretching. She is ready to get out of here. And
my spirit has left my body a long time ago. Absolutely. But it's been a fun morning. Thank you, guys.
It has, absolutely. The world news comes up at 12 o'clock. Do stick around. This is Inspiration 92.3 FM. Don't go anywhere.
This is the word for today.